Back pain, simple or complicated? You might be surprised, but it can be both. In this video and the next few, I'll break down the difference between simple low back pain and more complex cases that need extra attention. Low back pain is one of the most common complaints worldwide. In fact, about 80% of people will experience it at some point in their lives. And while most cases are not serious, some may indicate deeper issues, and knowing how to tell the difference is critical. Let's begin by asking a few key questions every clinician or concerned patient should consider. 1. Are there any bladder or bowel symptoms? If the answer is no, that's reassuring. But if the answer is yes, especially with numbness or weakness, it may point to Cauda equina syndrome, a surgical emergency. This requires urgent MRI and possibly immediate surgery to prevent permanent damage. 2. Is there unsteadiness while walking or clumsiness in the hands? If yes, this could signal cervical myelopathy, an upper spinal cord issue, not just a lower back problem. 3. Does the pain shoot down one leg? This suggests radiculopathy, nerve root irritation, often caused by a lumbar disc herniation. These cases are usually more complex and may take longer to resolve than simple back pain. Radicular pain usually follows a specific dermatomal pattern, is often worse than back pain, and may be aggravated by sitting, coughing, or sneezing. Simple low back pain, 50% recover in 1 week, 95% recover in 3 months. Radiculopathy, 50% improve in 1 month, 75% improve in 1 year. Is there pain in the buttock or legs that worsens with standing and improves with bending forward? This could be neurogenic claudication from spinal stenosis, another condition needing careful evaluation. Ask about night pain, weight loss, fever, history of cancer or trauma. These could signal infection, tumor, or fracture and need imaging. Start simple X-rays first, not MRI. Use MRI only when needed, like for neurological deficits or persistent pain. Remember, MRI findings don't always match symptoms. Up to 90% of people over 60 have abnormal discs without pain. Age 30 to 50, heavy lifting or twisting, prolonged sitting or vibration such as truck drivers, smoking, obesity, stress, or depression, conservative care like education, physical therapy, anti-inflammatories, and activity modification helps most patients. Surgery is reserved for progressive neurological deficits, failure of conservative treatment after 6 weeks, or severe disabling radiculopathy. If the exam, MRI, and positive straight leg raise test all align, surgical success rates can reach 95%, often with immediate relief. Back pain may be common, but knowing when it's simple and when it's serious makes all the difference. In our next videos, we'll dive deeper into causes, treatments, and myths about back pain. Don't forget to like, subscribe, and share if this helped you or someone you care about. See you in the next one.